y'all, it's me, Dr. Smina Rahman, Gyno Girl. Welcome back to another episode of Gyno Girl Presents Sex, Drugs, and Hormones, where we talk about the science, the silence, and the systems that shape women's health, especially when the systems fail us. Today's episode is truly a global conversation. We're talking about perimenopause, menopause, PCOS, primary ovarian insufficiency, whatever else we can get to through an internationally and a cultural lens, and really to ensure that those of us listening can really integrate cultural humility in not only taking care of patients, but seeking the help if you're a patient looking for someone. I'm very honored to be joined by Dr. Sadia Malick, who is a highly respected consultant obstetrician and gynecologist, a menopause and hormone specialist, and a global advocate for women's health. She's a British-trained OBGYN and a fellow of the Royal College of Obstetrics and Gynecology, and she brings over 3 decades of clinical experience caring for women across the UK, Pakistan, the UAE, and Saudi Arabia, where she currently practices. Her work spans complex menopause care, PCOS, reproductive endocrinology, and women's health education, particularly in regions where the conversations about hormones, aging, and sexuality are still stigmatized and silenced. What makes her voice so important is not only her clinical expertise, but her lived understanding of how culture, religion, family expectations, and healthcare access intersect with women's hormonal health. She spent her career caring for women who are often told their suffering is normal or inevitable, and to simply endure it, which we know we don't want to do. This conversation is really about visibility, validation, and cultural humility. So thank you, Dr. Malick, for joining us all the way from the other side of the world.
Thank you so much. I'm really honored, and I really love these conversations. And as I was mentioning, that I am of a different generation, and I was part of the doctors to start off with, where I used to tell my patients, don't use TikTok to give you information. I would be very upset with my patient. I heard on TikTok, and I would be so upset.
Well,
But then
it happens all the time.
But then I said, okay, if you can't win them, join them. So that was my motivation of, to be honest, so that was my motivation of increasing my internet presence, in terms of, I said, okay, if everybody is talking about it, I have a few degrees and a vast experience to talk about
Absolutely.
it. I think I should be doing it. So very grudgingly, I have come to the fore of this new internet revolution.
I think it's great. And I love everything that you're doing. I met your, I came across your profile online, and I was just so intrigued that I felt like I had to reach out. Plus, we obviously have some similarities, even though I'm in the U.S. My parents are from Pakistan, and you're also from Pakistan. And so I actually listened to I think it was one of your podcasts in Urdu, and I was trying to stimulate my Urdu.
Yes.
Because my Urdu is very bad. But, my parents spoke to me mainly in Punjabi growing up. And so that's why I still see patients.
Sorry, I was so glad for that conversation. You see, this lady, she's born and brought up in Canada. I mean, she's been in Canada for a long time, but she insists on calling herself the Urdu mom, and she does podcasts in Urdu. And I'm very proud of my Urdu. I used to win all competitions in poetry and things like that. So I was like, bring it on. Oh my God, I will use my medical concepts in Urdu. So I was very pleased about that. It went really well.
You do a lot of, what is it, shairi, the poetry?
Yes, I love Iqbal. I love, our and of course I know all the songs, and my mom is very upset that as to why I know the lyrics of songs like Noor Jahan and things like that. So when were you listening to it? You were supposed to be studying to be a doctor.
Oh my God, that's so funny.
But I still know all the lyrics.
Speaking of family and everything, my obviously I'm gyno girl on the internet, and so I like a good backstory. So tell us your backstory. What brought you into this women's health arena, specifically when we talk about OBGYN, sexual health, menopause, all these taboo topics that are still pretty taboo, I think, in other countries.
So I always talk about starting from my mother. We are 6 sisters, and growing up in Pakistan in a household of 6 sisters, you can imagine the amount of problems that girls have, and everything, psychological, physical, all of that. And I was the second in the lot, and I saw my mom dealing with all of us in her own best way possible, and most importantly, to really help to educate us. And I remember in all the problems, her standard line was, your job is to study. Don't worry about the problems and about the stresses and the stigmas and the abuse. I would use the word. It'll get very, very, not nice, these conversations, but that's what you face, psychological and physical abuse.
Yeah.
So I know women, looking at my mom and then looking at the stories of my sisters. I grew up and supporting them, and then my patients. So I always consider my patients as an autobiography. I have to listen to them, and because I really connect with their problems, I always believe that what a woman's story is, you have to know a story, and then we talk about PCOS and menopause. If you don't know their story and how you connect with them and share with them, so I think I was kind of tuned or into doing this as a very young girl, grew up into it, and then I said, this is what I have to do. And for me, every woman is a mother, and she is my mother. I see that, especially in my obstetrics, when I'm delivering a woman, I know that if my mom would have died during delivering me, I would never have achieved what I have achieved. So unfortunately, every 2 minutes a woman dies giving birth to a baby still. And so that's why it was such a motivation for me. And I'm a advisor to 4 international charities. I have founded my own charity in Pakistan, and when we have time we will talk about that. And we have reached more than 8,000 women, and hopefully saved their lives. But this is my main motivation for women's health, is that no woman should die, no mother
Yeah.
should die, and every mother should have a lot of support when her children are now in university and her husband is behaving like a kid also. you know so these women need a lot of support, and if
Yeah,
I can be
absolutely.
one of them, I am here.
Well, wonderful. Did wait, tell us about your charity, because I didn't know about this part.
Yes, so thank you very much. As I said, I've seen the pain of mothers dying. Unfortunately, I practice in Pakistan, and as a junior doctor, I moved to UK. But I never forgot the country that made me what I am. And so even since a junior doctor for the last 20 years, I have been returning to the mountains of Pakistan in the KPK province, taking my young girls to the most unknown places, do not mention to my husband. And we went there,
Take me
we
next
went
time.
there,
I'd love to go with you.
we went there to train midwives, because I love midwives passionately, and I believe midwives save lives, especially in the areas where you don't only have midwives. Even if you
Yeah.
tell me, Dr. Sadia, why don't you work there? I won't be working there. So we
Mhm.
only have midwives. So
Mhm.
I spent last 20 years going to the mountains to train midwives, and then
Mhm.
I've been a huge supporter of this all my life. I've advised a khidmat organization, APPS, so many organizations, but finally I said, I've got to do it myself. So in 2022, I co-founded Sakina Health Foundation in Pakistan, and where we use evidence-informed measures to go to the unreachable mothers, because the statistics are just stacking up. So
Yeah.
imagine if I give you 100% maternal mortality in the world, 100%, divide it into 50-50, and 50% of this maternal mortality is burdened by only India, Nigeria, and Republic of Congo and Pakistan. So we
Wow.
have 4 countries shouldering the burden of 50% of the deaths.
Wow.
And the reason, at least in Pakistan, is that the 70% of these deaths do not happen in hospitals. They
Yeah.
happen in homes and low resource settings. And
Mhm.
you have to come up with an idea to reach this 70% of the group in order to make a dent in these horrible statistics.
Yeah.
So, according to international guidelines, and I am advisor to WHO, I'm a stakeholder in the prevention of postpartum hemorrhage for the World Health Organization, and I have developed these clean birthing kits, which include 6 items, 3 for the mother and 3 for the baby. For the mother, we have a clean sheet which protects her from infection. Then we have misoprostol tablets, which you give to the mother after she has a baby, so it contracts the uterus. And the third thing is clean surgical gloves. Because when you deliver in the mountains of Pakistan, the midwife will come, she'll take a bag of onions, throw the onions out, rotate that bag on her hand and do a vaginal examination with that. I think that causes infection, definitely. Yeah,
Okay.
you just gobsmacked at this, isn't it?
So
So
amazing
that
that the resources are so limited.
exactly, and this is a very common practice, and that's
Right.
why when I talked to WHO, meeting, I said to them that the problem is that you do not understand the meaning of nothing. When we
Right.
start from nothing, nothing
Mhm.
means no toilet, no room, no running water, no heating, nothing, no clothes for the baby. The midwives have to remove a layer of their body to actually cover the baby.
Yeah. Yeah.
So the nothing is not understood by the world to then help the nothing.
Yeah.
So that's for the mother, and for the baby, we have a surgical knife, we have a cord clamp, clean surgical clamp, and a chlorhexidine cream. Because if the midwife will not have it, shall I put you through the quiz? Because I do this mean thing of asking this question. That if I, Samina, invite you to the mountains of Pakistan, and then we're having a great time, both of us, and we get lost, and now you are alone because I kindly left you alone, and now somebody tells, Dr. Samina, we're happy that you're in the mountain and this baby has delivered. So what are you going to do? How will you help that baby? So the baby has delivered. Now take me through what will happen next.
I mean, I guess you have to clean the baby off, right? You have to
Okay,
wipe the baby off.
clean.
Yeah.
Okay,
Yeah. The placenta's already out, probably, I'm sure.
with the baby. So
Yeah.
now you have a baby and the center attached to it. So what are you
No,
going to do?
no, you have to clamp the cord. Obviously, the baby's out, right? You clamped the cord
How
already.
how are you going to cut the cord?
I guess you're right. You have to have the instruments. You have to have something to, compress the bleeding and then cut. So there's no
Yeah,
scissors.
no,
No scissors. Yeah.
no,
Nothing, huh? There's not anything
no.
to compress it. Well, what about like a tie? Can you tie it off?
Okay, tie it with something. What do you have?
I mean, I'll take a nala and tie it.
Good,
Right?
yeah,
Can you
very good. Yeah, yeah, yeah. So to take a thread out of the nala, yeah, great,
okay.
great. How
And you
clean
tie
is
it.
it, isn't it? That
I know,
thread is
yeah,
so
it might not
clean.
be
Anyway,
right.
you've got the tie. Great. Now cut it.
Yeah, I guess I don't know. Is there a knife available to cut it?
You are not allowed to use the knife because the mother-in-law, the knife is clean, pak, and the
Uh-huh.
baby is palid. So you
Uh-huh.
cannot use this knife on the baby.
Oh, so you can't use any knives?
No, you cannot because
What
they are
about any
used.
scissors? Can you use any scissors?
They don't have scissors.
Mm. I guess I'd try to rip it with my hands. Is there nothing to cut it with?
I think
With
something the
a
man
razor?
uses.
A razor?
Yeah,
Yeah.
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 So where is the razor? So you'll
Probably
ask
not.
the children or you ask the mother, what does your husband use as a razor? Where is it?
Yeah, what do they tell you?
Where is it?
In the bathroom, right?
There is no bathroom. They
Oh
don't have
wow.
toilet.
Oh,
So
okay.
where is it?
Probably in his bedroom.
There's no bedroom. This is the room where they all
Okay.
live, eat, sleep. There's only one
Um,
room. It's a shack, right?
check. Okay.
So he keeps it outside.
Oh,
Where does
wow.
he shave? Where does he shave?
Probably outside then,
Outside.
huh?
Yeah.
Oh, okay.
Where
Oh,
he
so
has the animals. So he puts it on the top on the tree.
oh,
So the kids
wow.
can't get to it, right?
Yeah. Uh-huh.
So then when you say, can I have a razor? The kids will run, and they will say, we can help you. It's on the top of the tree. And what is at the bottom of the tree? The animals.
Oh, wow.
So you
So
got your
yeah,
razor, you
yeah.
asked for a razor, you got it. Now what have you given to the baby? Tetanus.
Yeah.
You have
Huh.
just introduced tetanus to this baby. That is why Pakistan
But
is
you
now,
probably can't, because you said there's no running water, right? So you can't clean the
there's no,
razor.
no.
Amazing. Wow.
So now Pakistan is in the top 3 countries in the world with the highest rates of newborn deaths, behind only India, Nigeria, and
Wow.
then Pakistan. Top 3 countries in the world. Imagine how many countries there are in this world.
Yeah.
Because of these practices. And see, Pakistan is a rural country, isn't it? And we are talking about the 70% of the deaths over there. So because of these practices, we have now more than 90 centers in Pakistan. We are working in every single province, and I can tell you that we work with the midwives. We know their practices, and this is the practice. They have not seen, this group of midwives has not seen a cord clamp,
Yeah. Wow.
and this
Okay.
our biggest challenge has been to teach them how to use a cord clamp.
Wow. It's amazing. You just
So
never think of it.
together,
Yeah.
yeah,
You just don't think
so
about it.
together with a clean birthing kit and a midwifery training, because you need to train the midwives. You need to tell them to please stop using this practice, because they didn't even know they just gave the baby tetanus
Yeah.
until you treat them.
Yeah.
And the other third most important intervention that we are doing, which I'm so proud of, is that we are the only charity who is giving IV iron to pregnant women.
Wow. Okay.
Because now we know the research that we got it wrong, that the reason of postpartum hemorrhage is actually lack of iron. Your
Just
anemic uterus is not going to contract.
yeah.
So
Yeah.
PPH is because of anemia and not because of lack of uterotonic.
Yeah.
You
Huh.
know,
Interesting.
so if we have to give, if we have the her iron to be normal and not to be anemic, her uterus will contract. Number one, Pakistan is in the top countries of the world with the biggest stunted growth. Stunted growth is due to lack of development of white matter in an anemic baby. When the mother is anemic, the baby does not receive iron, and you need iron for the development of white matter. And this is the biggest cause of to putting Pakistan's babies in the top of the world for stunted growth.
It's
So
amazing
we
the
are the
concept.
only organization who is giving IV iron to pregnant women and not tell them to take those cheap anemia iron tablets, which only
Mhm.
give them tummy pain, and they don't
Mhm.
eat it. They will not.
Yeah.
Have you
They
tried
won't take
eating a
it.
cheap tablet?
Yeah.
Nobody will eat it.
They're awful, and they constipate you and all the things, right?
Exactly. She already has enough problems than you adding to her problem. And she has
Yeah.
nothing to eat. Remember that. She has
Yeah.
nothing to eat. You know, when you tell her take it after you eat food, the first meal that she will have in her house, she's going to give it to her children and her husband.
Yeah.
Whatever is left, she will eat it. And that's it. They eat only once. They don't have 3 times a day meal. So when is she
Wow.
going to eat those tablets?
Wow. The poverty is really, huh. That's
So,
that's
so
astounding.
Alhamdulillah,
That's
we
astounding.
are,
That's yeah. Alhamdulillah that you're doing it. Wow, it's great.
and only with friends and family. And this is my aim in 2026, to hope to have some funding. This is through friends and family. Dr. Samina, we have reached 10,000 women. And
Mhm.
out of those, 8,000 women are alive. And I have an application. We have developed an application, and you can click on the application, and every woman's data will be there. These are real numbers. These are real women. These are real mothers. And the babies, the deaths in the babies is much, much less than the deaths they will see in Pakistan.
Oh, it's
So
amazing.
we are very proud of our work, and inshallah you will see it published soon. I'm trying my best to publish it, inshallah.
It's
And
very good.
we want people like you to help us to raise awareness. That's all, we want you to do, is to
Well,
talk about
during Ramadan, we should put a launch. The launch. What is it? Launch good
launch to.
for yeah.
We are doing that, and we
Okay.
are doing that, and this
I'll
time
put
we
it on
have.
my website and stuff too
Thank you
when it comes
so much.
out.
We want you to be our ambassador. So we are
Alhamdulillah.
collecting our ambassadors. And if you would kindly agree to it, we will add you to our WhatsApp group. So all these
Yes.
resources that you need to be an ambassador, in terms of what I'm saying, my videos, explanations, whatever you have, we just request you to forward it to your friends who trust you, that you are
Yeah.
forwarding something good. So
Good.
if you can do that for us this Ramadan, we will be
Done.
very good.
Done. Done. Well,
Thank
that's
you so
amazing,
much.
Sadia. I mean, really, it's just astounding that you're doing that, and I'm happy to help in any capacity because I think it's
Thank you
such a
so
need.
much. Thank you very much.
Um, let's talk about some of your other work and really about our understanding of how I've been practicing in the U.S. for over 20 years, but I've done a lot of international travel and talks abroad. But symptoms are minimized and normalized for women here in the United States. We're talking perimenopause, menopause. Do you think women are delaying even more because of cultural expectations and family expectations in the regions that you practice? I mean, I would think that would just make sense in my head, but like when it comes to like why is it that women aren't coming to see me? You're a midlife woman, you're carrying the world on your shoulder. You're trying to, take care of kids, maybe high school kids, maybe college kids, maybe parents that are elderly. There's so much that a midlife woman has that we just endure the suffering. But
Yeah,
I also think there's an element also in Pakistani culture and Muslim culture and in different cultures where the woman becomes like the matriarch of the family too, right? Like they have a lot of,
absolutely.
which I think is wonderful in terms of the way that women age abroad in that respect, because there's a lot more respect given to them. But don't you think the delay is there because of all these other cultural expectations?
Oh my God, where to start with, you are absolutely right. And it's more in Pakistan, more in UAE, Saudi Arabia. Uh, this matriarchal shift that you are talking about, when it happens, uh, the woman becomes the pillar of the household, the all wisdom, all wise lady, and also the gatekeeper of the tradition. You know, she's all of this, and everybody puts her in that high pedestal. Okay,
Yeah. Yeah.
but she ha, I would swap that. I said, okay, you are all these three things. I would swap that with strong bones, healthy heart, and clear mind, because these are the three
Mhm.
things you don't have,
Yeah.
you know, and 50%
Absolutely.
of you are going to break a bone, and your whole family who reveres you so much is going to keep on carrying you in wheelchairs and in beds and give you three maids and helpers to take you to the
Yeah.
toilet and bring you back because you've got a hip fracture and then you broke your other hip.
Yeah.
So
Yeah. Instead of you
something
going
has
out there and getting stronger and right. Yeah.
exactly, so something has to change. This is what I tell them, that. And then the other thing that we have to talk about, especially in Saudi Arabia or Middle East, is that, this word, the vocabulary. Let's start from vocabulary. You know,
Yes. Let's start with vocabulary.
we don't. It is so bad that, talking about these things is, first of all, we don't have vocabulary to talk about. At
Right.
least the West has found a huge list of vocabulary to define your symptoms, while over
Yeah.
here we are struggling to define menopause.
Yeah.
Sin al Yas, Sin al
Age of
Yas.
despair.
you know, you start from there. How do you give a diagnosis? Your FSH is 120 and you have got Sinalia.
Yeah. Which is age of despair, right? Age of
Age of
despair or something.
despair, exactly.
Yeah.
And then I will tell you something that so much so, your worth has been linked to your fertility
Yes.
for ages and ages and ages. How fertile you are, that is your worth. You know,
Hmm.
so there is something which I love that word, internalized ageism. So
Hmm. Yes.
I am trying to talk about, oh, come on, we're going to give you HRT, we're going to make your bones, and there is this severe sense of depression inside her, and her heart has just sunk, and she says, she's 49, and she says, so I can't have a baby, doctor. So I'm talking about 10 different,
Yes. You can have a baby. This is amazing.
and this is so sad that, literally that is what comes up. So you are sure I can't have a baby? And the
Mm.
sadness that overtakes her, that now she's going to go home and tell her husband, who's by the way planning another lot. So it is culturally acceptable now for him to marry again and have more babies from a younger wife, for him to move on. And to be honest, in their culture, it is accepted, and the men give a lot of respect and everything to all their wives, and she will always be the first wife. And in a lot of cases, they do love them as their children's mother and everything. But he has to move on because he feels that he has to have more children and everything. And yes, she's accepting of it as a cultural reason. But do you think she's happy about it? I will never use the word happy about
Be
it,
happy about it.
so these are the additional things that I have to deal with in these cultures,
Mhm.
which I understand, and I always, the different thing that I do is I bring in the man to have a discussion. Number
Uh-huh.
one, I always try my best to, which is very shocking for them as to why does Doctora want me in the
Yeah.
room? I said, no, I want you in the room, you know.
Yeah.
And
Yeah.
that's where I discovered the love that they have for them, which is a
Yeah.
lovely thing to see also because,
Yeah.
you know, once she told me, oh, he may marry again. So I'm like, I
Yeah.
want to meet them.
I need to see this guy. Who is it? They need to put him on
Exactly.
notice. Yeah.
But they turn out to be such lovely men who just want, you know, so you see that also very much. But it is very important that we address exactly what is going on in her head. I can't give her baby, so I have to give that bad news, let that news settle, which is like an accepted and given for many cultures. But over here, you know, it's very like much like that.
I mean, how many kids do you think the average people are having in Saudi these days?
So that is decreasing. So I would have said 20, you know, maybe 10 years ago. Yes, they have huge families. But
Yeah.
I will give you my own experience for last 3 years.
Uh-huh.
Only in 3 years, 2023, I joined Riyadh, 23,
Huh.
24, 25, and now 26, I will be completing my 3 years. The day, I've been running hormone replacement therapy clinics since in 10 years in the UAE and 20 years since UK.
Yeah.
So in 3 years ago, I would say, I think you will benefit from hormone replacement therapy. And the shock of it that you are giving me something that will give me cancer and you are confidently advising me to do that. So
Yeah.
from that shift within a matter of, I would say, 2.5, 3 years has changed drastically.
Good.
So
Good.
now they are very open to discussions for hormone replacement therapy. And at the same time, to answer your question, the children per head for women has also declined a lot because women are doing more work and they are deciding to, you know, not have as many children as before.
That's good. I think, yeah, and I feel like the shift obviously has been happening here for the last few years too, where the association isn't as, severe as it used to be from the WHI, which I'm glad to hear that it's kind of transferred over in your arenas as well. Um, do you think when we talk about perimenopause and how it presents, um, are people chalking it up to it's just stress or it's just aging or like or what kind of symptoms are differently presenting from you that would we would
Yeah.
see different?
So absolutely, we have research to prove. There's a very good paper also that they did about it. I talk about it in my talks. The Asian woman does not present with hot flushes and night sweats and sleep disturbances. Asian woman, top complication, top presentation in Asian woman is body aches, joint pains, and mood, and low mood. I promise you sadness. That's why they call it Sinalias. And that it's just a feeling, a horrible feeling. I think in the West, women have other things to do to cheer them up. So they may be having a bad night with hot flushes and night sweats and whatever. But their mates are there in the morning and they're going to go for a run or a walk or a jog or dance in the evening or something like that. I think that's my interpretation. But physiologically, these women do not get as many hot flushes and night sweats as the Western women get. But the joint pain, every single part of the body hurts. It's very more common. And there's a paper also about it.
Do you think, I mean, so, because like there's this general feeling of temperature dysregulation too, like some people just feel hotter than normal. But if
Yeah,
your
yeah,
temperature, like, climate wise too, is like much warmer there. And
yeah.
so that, sometimes you would expect people to maybe feel even hotter than they usually do. I mean, I would say that here, of course, people come for vasomotor symptoms, but one of the biggest symptoms I think women are coming for now is mood disruption. Really, mood is
Mm,
huge, right? Or just not feeling like myself. I think that's like a big issue that we see as well.
mm,
Most people associate, menopause and perimenopause with vasomotor symptoms. But I think when we start telling them that their new onset anxiety and depression and all of these things are related to
mm.
hormonal flux, then it's not only empowering, but it makes them want to come, get some therapy. So do you think that that has a factor at all as well?
Yes, definitely. I mean, they're in AC all the time. So everybody talks about hot countries, and I talk about my jackets. I've never worn
Yeah.
so many jackets in UAE and Saudi Arabia as I've worn them in UK.
Yeah,
So
this is
they're always in lot of AC all the time. So I think that's one of the things that the ones that are truly tribal, the nomads that are there, but they are strong women. They are, bless
Yes.
them, nobody even reaches to them to say how you are feeling. And unfortunately, then that is expressed as psychological symptoms of anger, rage, crying, emotion, and
Mm-hmm.
manipulation, because you don't understand what is going on with you. So and nobody is explaining to you. So you're going to take it out on your family, isn't it?
Yes.
So
Yeah. Yeah.
unfortunately, the mother-in-law culture, as I said, every complaint about mother-in-laws that I get is just a
Menopause.
cry, crying out loud for having a HRT,
Yeah.
indication for HRT. That's
That's
what I
totally
hear.
true. And that's sort of the stigmas around, even having a mother-in-law live with you and all the things is that, oh, she's gonna be demanding and yell at you and
Yeah.
but I think you're totally right that they're just being undertreated. I always joke and say, we have like this joke that like the Karens of the United States, it's what we call them, is for the people that are always like trying to call the police on black people in the parks and stuff like
Yes.
that. That we all, I always joke like maybe they're just all sure they're underlying racist potentially, but maybe they're just all undertreated because most of them are midlife women. But I think that that's probably the case a lot for so many of the mothers and mother-in-laws in that society.
Absolutely. Nobody's talking to them. And the Asian women, we now know that their menopause is much, much earlier. So
Early.
we are talking about 40, 45. Already your FSH is in the hundreds and estrogen zero, and now you're 52. So you have 10 years of no estrogen by the time you reach 50, 52. So where would
Yeah,
your mood have gone by now?
that's so true. That's so true. Yeah. Do you think how like between religion and family opinions and even like social media is big everywhere? Like, how does that play into the fears around hormones or the fears around aging?
Unfortunately, religion is taken as like if you're talking about libido or sex or anything like that, then you're a bad woman.
Right.
I don't know where, and I think again, I'm on camera saying these things. I really think that mother-in-laws, when they don't have this at all, so then you hide behind being extremely religious.
Yes.
So this persona of being extremely religious would mean that we don't do these kinds of things. So anybody who does these kinds of things would be in that non-religious thing to be looked
Yeah.
down upon.
Yeah.
While basically the reason is that you don't have any estrogen to do those kind of things. So now
Right.
you you hide behind that, saying that
Yeah.
anybody who has estrogen and wants to dress up and put some lipstick on
Yeah.
is non-religious.
Yes. Oh, that's so true. Yeah, that's true. Actually, I could see how that plays out.
Yeah.
Do you think the partners are like the husbands? Are they seem to be more supportive now in terms of like getting women treated and getting on board with some of these therapies?
Yes, absolutely. I mean, this is the power of social media. As I said, again, being a proponent of being upset about social media to
Yeah,
totally turning to social media, the first big thank you, yes, yes, we have to thank Dr. Mary Claire Havers of this world, Dr. Wanda Wrights of this world, Dr. Saminas of this world. We have to thank you for bringing it to, but in the end, we have to thank the social media. Uh,
yeah.
uh, this
Look how small our world became. I'm talking to you, and you're in Saudi Arabia, and I'm in
yes,
Chicago. Yeah,
FDA,
yeah,
Mr. FDA, with all the misters in charge of FDA, for 20 years, they put a blind eye to it with all
yeah,
the evidence screaming in their face, but they were on the high pedestals until in 2025, it was not the evidence that changed them. And I'm coming on camera and saying that. It was the
yeah.
hue and cry of millions and millions of women. The pressure was unbelievable that now
Mhm.
they're turning Mr. Nice Guy and say,
Yeah.
thank you very much, we've changed the rules. No, hello, no.
No, exactly. It is. It's just, I always say that too. I mean, what was striking to me even was how the CDC came out with a statement about use of pain relievers for IUDs. Where in our training we were just told just shove it in there and there's no nerve endings. Women can deal with it. But literally, women were videoing themselves on TikTok getting
Yeah.
IUD insertions, And that virality is what caused that change, you know?
Exactly. So that's why I just think we thank the social media and these things where it is good in the sense that that is a main movement that happened for us. And finally, FDA changed their mind about things, and so many other good things are happening. And men
Absolutely.
now, sorry, your question was about the men.
Yeah.
Absolutely, now that the men are getting involved and they're listening that they don't have a mental wife, but she's actually got a diagnosis, which is perimenopause or menopause, and there's actually things that are supposed to be done about it. And that's why this is also the shift is happening.
I love it. I love it. And we see this across the board with hormonal shifts. We know also we were going to talk also a little bit about PCOS and how we know that South Asians tend to have more PCOS. Like I think 1 in 4. We have more heart disease. We have Pakistan's #1 in diabetes in the world. So we know we have this cardiometabolic dysfunction that we sort of inherit genetically.
Yes.
Um, Tell me about how PCOS kind of the differences in the presentations that you see, Pakistan versus Middle East, compared to what we might see here.
So after practicing for so many years in the UK, when I came here, I came here in 2014 in Abu Dhabi first. And I was like, everyone had PCOS, everyone.
Mm.
And so I always question, again, as I said, we're all very much into our evidence and things like that. So I've always stuck to my ESHRI, signs, symptoms, investigation, 2 out of 3. This is what
Yeah.
is my thing about PCOS. So I would want to diagnose it according to the ESHRI criteria. I would always say that to my patients. So
Mhm.
in that, when I would do, I I would say, yes, it was very high, but 50% would not meet the criteria. And my
Right.
diagnosis for them was obesity,
Yeah. Yeah.
that
Exactly.
you are obese, you know.
Right. Yeah.
So
Yes.
let's tackle obesity. So we can talk about cause and effect and cause and effect. But just prove me wrong, because at the moment that your signs, symptoms, and investigations are not coming up to be according to ESHRI for me to diagnose you as PCOS. So let me manage your obesity. So that's
Yeah.
one thing. Second thing, of course, out of the 4 types of PCOS, 70% are insulin dependent, are the insulin resistant PCOS. And the diagnosis for that is to say my parents are Arab or Pakistani. Then the diagnosis is made, I'm really sorry, but you've got these genes and it appears you have got PCOS. So that's your 70% that you have been given with these insulin resistance, your insulin resistance or your PCOS. And then
Yeah.
the very small amount then comes as to the one which is adrenal PCOS and your post pill PCOS, which people don't tend to remember. So the presentations in this group, if you're insulin resistant and you like your carbs, that's bad news, because you
Yeah.
cannot you can, I'm sorry, other people can have their cake and enjoy it also. You can't have your cake. You
Yeah.
can't.
Yeah.
And I can tell you so many stories, because my best friends are all fertility doctors. Now,
Mhm.
again, we follow guidelines. I'm a gynecologist of 30 years. I know, mashallah, a lot of things about fertility, but I
Uh-huh.
always raise my hand up to my patients and say, I'm not a fertility doctor. I'm not
Sure.
a fertility, because I
Yeah.
don't have a piece of paper to say I'm a fertility specialist.
Right.
But still, my friends always, when they have a difficult patient for fertility, they say, go to Sadia. So, in terms of fertility, I have already, without any medications, I have convinced women to just increase your muscle mass, stop your
Uh-huh.
carbs, decrease your visceral fat, check your husband's sperms, and
Yeah.
got them
Absolutely.
pregnant.
Yeah, no, it's true. And I mean, I treat a lot of vaginismus in our community too. So I'm not sure with pelvic floor dysfunction and actually the physical act of not being able to have sex, right?
Yes.
So I always joke I'm not a fertility doctor, but because I'm a sex med doctor, that I can help women become pregnant by helping them cure their
Mm,
pelvic floor
mm,
issues, right?
mm.
And I'm sure you see plenty of that as well.
vaginismus is very common in Saudi Arabia, much, much more common than I saw in UAE. I don't
Mhm.
know. I really am not the expert to tell you why, but I can definitely have my reasons behind it. It's just wrong ways of, not talking, giving sexual education in a correct way and so many things. But when the time comes, oh my God, these girls are really stressed out. And my God, the pressure of the family trying to for you to
Yes.
produce a baby at
Yeah.
30 days after marriage, it's just
Yeah.
like very, very, very strong and doesn't help these people. But we really, yeah, vaginismus is very high here.
Yeah. Yeah. I attended the World Sexual Medicine Conference when I was in Dubai, and that was probably the biggest topic was how to overcome the
Yeah.
vaginismus treatment, which there's not a lot of pelvic floor PT in the Middle East,
Mm.
which I think is one problem. And I think the other issue is just, the lack of education, the lack of talking about it and sort of like destigmatizing some of it. But it does seem to be a significant issue when it comes back to I forgot to ask you about the menopause stuff in terms of how much genital urinary syndrome menopause you're seeing and how many people are actually getting treated for it.
So that's the topic. My friend runs a huge conference over here in Riyadh, and she said, "What do you want to talk about?" Last year, I talked about menopause, and she said, and hormone replacement therapy, particularly, and the risks and benefits. So she said, "Well," I said, "I'm only going to talk about genital urinary syndrome and menopause," and she was like,
Yeah.
"You're going to use half an hour to talk about GSM." I said,
Yeah.
"I need 24 hours to talk about
Yeah.
GSM. It
Absolutely.
is so close to my heart, and especially after, oh, bless them, whoever these guys are, the American Urology Association. Like,
Yes,
I
the
am so
guideline.
embarrassed I'm embarrassed as a gynecologist that the Royal College, the American College, nobody woke up to it, and the
Mhm.
urologists just ran and they made this guideline, which is the
Yeah.
best guideline possible. And they took
Absolutely.
the research of 11 million women, 11
Yes.
million women divided into half. Those who use vaginal estrogens
That's
will have a 70% reduction in death, people. I mean,
yes.
who would have said before 2025? I would have said everything except the fact that, madam, this tube is going to decrease your risk of death by 70%. And bless the urologists that they have given me this, even that our mamas, they go to urgent care, emergency centers with a bit of a confusion. The A&E guy says, "Oh, mama's got sepsis. I don't know from where," and mama dies. You know, how many deaths are because the vagina is supposed to be acidic. It is now alkaline. You don't have estrogen. Every single
Right.
bug is welcome. You have a small urethra. Up, up, and up. All the bugs go live in your
Yeah.
urinary system.
Yeah.
Hello, you've got old burning urinary tract infection. It'll take 10 years, but it will kill you. You know.
It's so
So with
true. We used to always say that this was this is a life-saving measure, but I was so happy when the AUA came out with those guidelines. Um, and in fact, and even changing the nomenclature in 2014 when we withdrew the term atrophy, vulvovaginal atrophy, and they were initially actually it was interesting because they were initially going to just call it the genital syndrome of menopause, and it was a urologist, Dr. Irwin Goldstein, who's like the godfather of female sexual medicine. He's one of my mentors. He's the one who was like, we got to put in urinary too, because it's the urethra, it's the bladder,
yeah,
it's the cystitis,
yeah,
it's the infection risk.
yeah,
And so that was, I think, a big moment, that changed really the trajectory of
yeah.
women's health in so many ways.
Yeah, I am a big in my desk when you, inshallah, I hope you come and see me in my clinic.
Yes, we'd love to.
And
Yeah.
so I've got the famous thing which doctor always uses, Dr. Nighat Arif. She always has got that uterus in her hand, and I love her so much. She's an Asian Pakistani woman in
Yes. Yeah.
United Kingdom. I love her so much. So
Very.
big, yeah,
We.
big love to her all the time.
Yeah.
Yeah, she's got
Have
that
you
uterus
had?
in her hand, and I have the same uterus in my
Oh,
clinic.
that's awesome.
Um, so I've got that, and I've got the applicator, So I
Yeah.
sit there, believe me, with every perimenopausal woman. I started after 40. Any
Yeah.
woman after 40, I educate them on this. I said, it's like your face. Why do you
Yes.
put cream on your face? Nothing really happens. You use so many
Yeah.
creams and nothing
Yeah.
really
No.
happens.
Sleep prevention.
But But you do keep using them, isn't it? Because if you will not use them, I keep on saying, what will happen to you if you will not use them? That's exactly what is happening down there. So, and now we know there's no risks associated to it. And I can tell you like so many stories that how women have come back and said, this was the best thing that has happened to me. So please, everyone after 40, start using.
Absolutely. Well, I also want to, speaking of 40, like I think that you've talked a lot about the primary ovarian insufficiency and some of the issues. Do you see it more commonly where you are in terms of like this
Absolutely.
premature menopause, primary ovarian insufficiency, which is less than age 40, where you have, entered into the state?
Absolutely. It's a topic which is very, very close to my heart. And I always say, like 10 years ago, if my junior would come and say to me, this girl has irregular periods and I did an FSH for her, and I would be thinking, why were you doing FSH? What were you thinking? I said, oh, POI. So why should she have POI? It's one of the 10 years ago. But now it's a must for me, for every young girl, as young as she would be, I would just check her FSH. And so that was my practice. So when I came here, the first research project that I suggested to King Faisal was POI, and they said, we don't have POI. I said, oh, okay. So I looked at the numbers in three centers, Jeddah, Riyadh, and Medina, and I looked at last 20 years, and I found more than 1,000 women who were less than 40 with a raised FSH. And when I did the number crunching, I found out that because we are huge tertiary hospitals, 60% of these were actually patients who were post chemotherapy. So we get these 18-year-olds, 20-year-olds, we give them chemotherapy, they're cancer free, but now they've got menopause at 23.
What
And
kind
we
of cancer
discharge,
are they dealing with?
sorry,
What kind of cancers are they having at that age?
because we are referral centers, so
Oh, okay.
so we are referral centers, so we get all kinds of cancers. So majority of them were bone cancers, blood cancers, and then transplant patients, because when they have transplant, they do give them suppression, and they ended up being menopausal. And then these patients were sent home to
Mhm.
family medicine doctors. Do you think family medicine doctors are going to continue? And the 30%, only 30% of these patients were started on HRT, and they were told, you can take this HRT, but you will get cancer with it. Already she has come out of one kind of cancer, and she's going to take this medicine. So and then I compared these results to the tertiary hospitals in Canada and in America. And guess what the evidence is telling us? That there is fragmented care. Even in the best hospitals in the world, there is
Sure.
fragmented care for women
That's,
who once they come out of. And I'm
oh,
so
we know
happy to
that.
say that, yeah, so this was my first research, and it got accepted in one of the best journals in the world, a Q1 journal. Menopause is an American journal. I'm sure you know about it. So it will be available online soon, and I'll send you the link. It just got accepted.
Oh, wonderful. Awesome. I love it.
Yeah.
Okay. That's great. Well, I
So
can't wait to
so
see it.
that's
Yeah,
Yeah,
that's
it's not yet available online. So as soon as I will get it, I will send you the link. Very
okay.
happy about it. Really pleased
Wonderful.
about it, because I want to shout out about this, and I got a good, platform to shout out. But the next
Yes.
thing is now to talk about the POI quality of life questionnaires, because
Yes.
the POI questionnaire that you have across the board, it has got no information around cardiovascular health and bone health.
Oh, yes. Agreed.
This
Yeah.
is not highlighted in these women. So they only talk about babies. Oh, you can't
I
have a
know.
baby.
I know.
What you gonna
I
do about a baby? Okay, that is
What about
important,
your
but
risk of death and your heart disease that you're going to get? Exactly.
exactly, you're going to die earlier according to the new HT guidelines. Unfortunately, you have a high risk of dying earlier due to cardiovascular death and bone disease. You'll
Yeah.
have 4% of my women in my research, 4% already had osteoporosis. You know, so we have
This
to
is,
help these women. But
mhm.
the other question that you are saying, that is this more? Absolutely. I tell you, with my work in POI, I can confidently tell you that it is underreported. It is much more than the current prevalence that we are talking about. And the reason behind it is, first of all, your endocrine disrupting factors in your makeup. That's the first thing I always shout out about. Your vaping and smoking, which the girls taking out their stresses by actually vaping and smoking, is killing you
Oh,
and killing your ovaries. They never connect this together. And the
yeah.
horrible advertisement of cold smoke. Oh my God, how did
Oh,
they get away with it? I caused this cold smoke. Only
what
today I
is,
saw
what do you
this.
mean by cold smoke?
Sorry?
What do you mean by cold smoke?
Yeah, they call it IQOS, these vaping things. It's
Oh,
cold, so cold doesn't harm.
oh, is that right? Okay.
Yeah, every single teenager tries to teach me when I'm teaching her. They say,
That's
but
ironic.
it's
Yeah.
cold smoke. I said, so TikTok taught you it's cold smoke, so it's okay to vape
To
until
do.
you don't have any lungs.
Yeah.
Vaping associated lung injury, valley, is now a thing that you know that your lungs are totally destroyed by all kind of cold smoke. But
Yeah.
what
No,
about
that's
your
right.
ovary, darling? You
Yeah.
have no eggs left. Do the
Yes.
AMH. I had a very important person, a very, very high up figure she's a actress
Mhm.
in the Middle East. And she said to me, you can't tell me to stop vaping. I said, your makhzoon, they call it makhzoon, AMH in Arabic. I said, your makhzoon will finish. She said, I'll buy it.
Oh my God. That's
I said, where
crazy.
do I start now? Where do I start this
How do you get to
conversation?
do that? I know. Yeah.
How did you get to buy makhzoon, madam?
Um,
Just
oh my
speechless.
God. Speechless.
But I made her sit down and cry, and I did tell her everything.
I made her cry, okay?
I didn't make her cry, so that came out wrong. But she ended up, once she let me explain to her
Then
that,
she understood. Yeah.
yeah, then she understood that. Then she was like literally crying. She said, nobody ever told me that.
Oh,
Nobody, you
see,
know,
but then you need the time and you need the patience to talk to people, which is
to
something
do
you
that.
have.
Exactly. So,
Yeah.
so this is what is bringing on POI. Endocrine disrupting factors are bringing on POI. Your cheap fashion is bringing POI. If you just Google polyester, okay, this I've learned from my daughters. They read about these things. You go and you just the most expensive clothing. If you go inside and see what is inside, it says 100% polyester and it's 200 pounds just because it's from a fashion brand and it's a fashionable thing to wear. It is stating there clearly on that piece of clothes, it's 100% polyester. So that means you're wearing a plastic, you know, and that absorbs from your skin and that affects your ovaries. So we have to send out this message for young girls that when we talk about perimenopause, people ask me, so Dr. Sadia, when do we talk about perimenopause? When does it start? 30, 35? I said, please push it to school. Push
Yeah.
it to the school girls. Let's talk about perimenopause to the school girls. So we tell them that, darling, you are born with a finite number of eggs.
Mm.
Okay? So now you're going out into this world and you will have several life choices. And yes, you can say it's my life as long as you understand that some of the life choices will affect your health in the future.
That's
So
good. Yeah.
already you are bringing the POI further forward and forward in the same way you are going to bring the perimenopause at 40 or whatever because
Mhm.
of these life choices and education and educating yourself about your health is
Yes.
what I'm
Absolutely.
doing.
Absolutely. Well, I love this conversation, Dr. Sadi. I want to be cognizant of your time. What else? I have this thing. My husband jokes that the people that listen to my podcast are vagilantes. So I have this end thing that I do at the end, Vagilante verdict, which is your hot take. Like, what's your one piece of advice you would give to the listeners about any of what we're talking about, so that they can take home something? What's your take home message?
Education, educate yourself, please educate yourself. Please don't let anybody else wait for you to have harm. um, as as a menopausal woman, you are looking at 1 in 8 risk of developing breast cancer. about 1 in 4 chance of developing heart disease, 1 in 3 in having a stroke, and 50% of you will break a bone. So together, we need to do those choices in life where we change these figures. That's
Yeah.
all that I'm trying to do. I don't like these statistics for myself. I don't
Mm.
like them for any menopausal woman. But we will not be able to change these figures on waking up at 40 and saying, oh my God,
Yeah.
no.
What should I do? Yeah. Yeah.
Exactly. So now,
Yeah.
when this movement has started, we want this conversation. So my take-home message is to have this conversation with the teenage girls.
Mhm.
Everybody should have this conversation with the teenage girls. So the education should start from the schools, and by the time you're 40, it's not that moment like many women sadly are now waking up to.
No, it's so true. In my household, I have two girls and a boy. My youngest is 6 and my oldest is 14, 15. Sorry. But my little one, 6, whenever I get a little bit irritated, she's like, "Mama, is this Scary Perry?" Like Scary Perry menopause. I'm like, "Yes, Scary Perry is coming for you."
I like that. I'm going to use that definitely. But see
Yeah,
now, what an amazing thing that these girls are. This generation is going to go into this. That
I
they
know.
don't want to be. Yeah. So that's just great. But unfortunately, working in the mountains of Pakistan, where where
Mm.
your problem is daily food, do you
Yeah,
think those women don't go through menopause? Do you
yeah,
think they don't cry? Do you think they don't feel sad? And
yeah,
they have. So I always say कि दर्द की ज़बान नहीं होती है.
yeah.
There is no language of pain. It's the same across the border, across economic status. It is
Mm,
the same. A woman is the same across the whole world and
so
across
true.
the social. So imagine when you are mourning about your problems. There is this woman who is going through the worst kind of menopause, and she hasn't even got food on the table. And we haven't even talked about mental health. That takes you to suicide and this strange deaths that happened in the night. People don't record suicides from where I work. Women take their own life. In the United Kingdom, the number one cause of death, in the United Kingdom, the average age of death is 51. Suicide, sorry, the average age of suicide for women is 51 in United Kingdom.
Yeah,
Does that
it's,
not ring a bell?
yeah.
So
No,
women are left alone to sort their problems out. So we should all join hands together to, as I said, make hormone replacement therapy available all across the world, to whoever needs it. As I said, mental health is huge for me. For me, the
yes,
number one reason of prescribing, I go over and beyond to the risks and benefits discussion if I feel mental health is involved. And I
yes.
give hormone replacement therapy to improve mental health.
Mhm.
So which I think is the core in menopause and perimenopause.
And it's so
Your
taboo, right?
divorce rate, yeah,
Yeah,
your suicide, 70% of divorces happen after menopause.
mm,
70%.
yeah. It's
That's
astounding.
just not right.
Hmm.
So, that's huge for me, mental health.
Oh, I'm glad you're doing that as well. I mean, I think that's one of, like I said, one of the biggest things we see in the office is people don't feel like themselves. They're getting anxiety attacks. They're panicking. Their mental health is declining. So I agree.
And then
It's
the relationship total breakdown with your own children. I
yes.
had this lady and she had 3 children. And she came to me when she was 45, and I looked at her results for last 10 years. She was menopausal. She had premature ovarian insufficiency since 32,
Hmm.
and she met me at 45. And then I diagnosed her that you've been suffering from menopause for 15 years, and I started on hormone replacement. She came back. She cried when she first met me. When she took the hormone replacement therapy, she came back and she was crying again. I said, I'm crying now with happiness because she said that she had a divorce and her
Hmm.
3 children stopped talking to her because they said, you're not our mom anymore. But after the hormone replacement therapy, she got back with all her children. So
That's
she was
great.
so happy that and they say, Mama, you're back, you know.
Yeah. Yeah.
But she cried. She said, Sadia, I can't get my husband back,
Yeah.
you know.
It's,
So there are
mhm.
so many stories that we can actually change if we
Right.
listen to the patients. And the only question she asked me, you met me for the first time and you talked about FSH. Why didn't for
I
15
know.
years
I'm
I'm seeing
talking
doctor,
to. I know.
you know?
I know. We hear the same thing
So,
here.
yeah. So what we do is really very important. We save lives and we save marriages and we save, children's
Relationship.
mothers.
Yeah.
And
Well,
that's
this
what
is
we
great, Dr. Sally. I love everything you're doing. I look forward to collaborating with you again, and I'm serious about this ambassadorship. I'd love to be involved.
Thank you so much. That's I really, from the bottom of my heart, thank you so much for agreeing to that. We won't bother you much. It will just be on a WhatsApp. So whenever you have the time, just to forward it to people and maybe have some
Wonderful.
iftar parties and things like that. So we've got lots of ideas and things.
Oh, so great to meet you, Dr. Sadia. Okay. But anyway, so glad that I was able to do this with you, Sadia. I will be in touch with you after.
Thank you very much. Once again, thank you very much for this opportunity. And I feel as if I found a new friend over the phone.
Please subscribe to this podcast. I'd love for you to be a follower and learn as much as you can about the things that we're going to talk about with all the people on our journey. Please review us on Apple or Spotify or wherever you listen to podcasts. These reviews really help. Review us, comment, tell me what else you want to hear to get more information. My practice website is www.cgcchicago.com. My website for GynoGirl is www.gynogirltv.com. My Instagram is GynoGirl, so please follow me for some good content. Additionally, I have a YouTube channel, GynoGirl TV, where I love to talk about all these things on YouTube. And please subscribe to my newsletter, GynoGirl News, which will be available on my website. I will see you next time.